Another Friday episode of John McEntyre Show live. John McEntyre. You know who this is beside me here? This is the Friday Medicare Queen. Um, but when you see her, we're going to be talking about Medicare with it being Friday, which is Andrea McEntyre. Hello, Andrea. How are you doing today? Hadn't seen you.
Well, I'm doing well, doing well. I've definitely been busy meeting with clients, and occasionally I'll harass you behind the scenes.
Mm-hmm.
But I'm doing well. Happy to be here this Friday, and we're getting very close. Annual enrollment period. It
Mm-hmm.
starts on the 15th, so that's Tuesday.
On Tuesday, exactly, and that's why we're here to actually do this countdown. Um, and what we wanted to talk about is actually, we'll be talking about choosing the important items to look for you for choosing a Medicare Advantage plan, because that's what this AEP is for. Even though we're sounding redundant, we're just reminding people that's what it's for, because people are still asking, does this,
Does it apply to me?
does it apply right to Medigap and supplement? Notice specifically for Medicare Advantage and prescription drug plans, Part D plans.
Yes.
So that's what it's for. So we have to just keep stressing it, because more people see it, they'll contact us to ask about that question. So some of the people that's watching have seen the other Medicare shows. They're saying, you talked about that before. Well, each time there's someone new coming in, or they've seen it and they ask the question. So we have to make sure it covered for it. And so before we actually get into the show, just want to make sure and talk a little bit about Helene. People that were affected by Helene, the bank, the businesses, and the schools, the citizens. Everyone. And we're talking about Medicare as well as our older generation. Everyone's faring well, and now it's just actually getting into the nitty gritty of rebuilding.
Yes. Yes. Well, I would say there's a few things that we should probably think about when we're thinking about our neighbors and family and
Mhm.
communities that's affected Western North Carolina, into Tennessee, and even some of our family and friends we know in Florida who were, like you mentioned, they were
Mhm.
cleaning up from Helene, and then Milton just
Right.
dropped so much additional rain, and then they had um,
Yes,
tornadoes
tornadoes.
to
Yeah, a
to
ton
spin
of
out of
tornadoes.
it.
Right.
So there's a lot going on, and you're right. A lot of people are getting power back. They're starting the phases of, okay, we're feeling okay, and
Mhm.
now it's starting to sit in what all has really happened. Trying to assess, what do I do next? What do I what is our next move? Like
Right.
with
That's right.
businesses, do they rebuild? Families, do I need temporary housing?
Hmm.
And then there's important decisions coming up, like for those who are in Medicare Advantage plans or faced with some decisions. They've got to come up with a plan. I need to look at those things. How can I get some help? And then there's the election that's
Right.
coming up as well.
That's right.
So people have a lot of immediate needs going on. And then there's some important things that they're also needing to prepare for. So let's keep them in our thoughts and prayers. Let's also remember that we're not they don't need us just one time. They're going to need us
Hmm.
more over
Exactly.
the days, months, and years
And
to come.
years. Exactly. Exactly. Because we're reminded here uh, in the Charlotte area, even though uh, Charlotte still has some spots that are, in repair across into, pretty much the Charlotte metro. It was affected also, but not nearly like
Yeah,
Western North
yeah.
Carolina.
Mhm.
But we're feeling effects because all of the highways are shut down in the western part of the state. So all traffic is coming this way to get around, to actually go to Virginia, West Virginia, places. Either they have to go, maybe into Alabama, up into Tennessee, something like
Mm.
that, or come this way. And so the traffic, everyone has been affected. The trains are like running more frequently, and they're
Mhm.
much longer and has more cargo things like that. It's the stuff that just everyone doesn't think about, and so we're all being affected by this, and that's why I want to keep it top of mind, especially here, because um, we see the effects every day.
Yes,
We're
yes. And a
definitely.
lot of people are complaining, oh, they're doing so much building and the road
Hmm.
infrastructure. Some of those things may be valid, but right now
Hmm.
we are the we are the reroute or the detour for
Hmm.
many of those major interstates that have, and just main roads
Hmm.
being shut down. So um, take a pause. We've got a lot to be grateful about. We are coming from homes that didn't go through devastation as we're
Hmm.
commuting to work. Many of them may not have a job to go back to, or they're in temporary
Or their
shelter
business,
trying to
they've
get
lost
to
their
work.
business. So right.
Hmm.
Exactly. So yeah, there we go. We want to just make sure keep them in our thoughts and prayers. And I'm just going to talk about it because we are uh,
We're
affected.
affected.
Yeah, we were directly affected. Now we're indirectly affected, and we're going to be involved in it. For as long as they're in repair and rebuilding, we're going to be involved in it. So, but we're here to talk about Medicare today, and let's get into the day show is about actual choosing the best Medicare Advantage plan for you, and this is the four main items you should look for when choosing a plan. And so, getting into it, number one, we should look for your providers.
Yes.
And this is, like I say, this is sort of redundant. But this is a reminder because it's just that important. Because once AEP is over with, we probably won't mention it too much more after that. So
Right.
we're having to talk about it a lot now.
And it's just stressing the importance. So
Yeah.
your providers, when we're saying providers, we mean your doctors,
Mm-hmm.
your specialists. And many people see more than just their primary care physician.
Mm-hmm.
Depending on where you are within your healthcare journey, you may only have one doctor.
Mm-hmm.
But as time goes on, you could potentially have anywhere between 3 to 4 doctors. You could have,
More.
a neurosurgeon. You
Yeah.
could have, maybe you have some other complications with your health.
Yeah. You
Um,
may have a fall, an accident, or something like that.
mhm.
But as we age, falls they do go up.
Yes.
They do go up, and so that's usually the big one. So then you have the orthopedic surgeon, you have surgeons, chiropractors. You have to just make sure that all of those people will in the beginning you may not need those. So starting out, the doctors that pertain to you.
So your primary care doctor
Hmm.
at a minimum for your annual visits, or if you're
Hmm.
on semi-annual.
Right.
So there's the doctors. Then the next thing to look at is the hospitals,
Hmm.
because your doctors and your hospitals, you want to make sure they're considered in network.
Right.
And they're in network means that they are within your plan, and they are at a generally a lower cost than what is out of network.
Right. So when we talk about network, then we're getting into, you either hear HMO or PPO,
Hmm.
and we want to we sort of lean towards PPO for the
Yes.
simple fact of it has a larger network,
Hmm.
and if needed, you can go out of network. You can choose to go out of network. You may have to pay extra or whatever, but you don't have to receive referral. You won't have to be referred. You can actually make the call yourself.
Absolutely. And flexibility,
Excuse me.
you're making a choice. Often the flexibility that you may need for in network or out of network, or for specialists,
Hmm.
that right there, sometimes you pay a little extra for you to have more choices. And there's also, when you choose, let's say, an HMO that is restricted to a network, and then your primary care physician has to make that referral for you.
Hmm.
So you can't just decide to go to a specialist that your best friend goes to. You have to call, and you have to ask your doctor to make that referral,
Hmm.
or you're calling your insurance company to see if they're within the network.
That's
But
right.
you have to have it go through your
You have
doctor.
to have it go through. And let me say this: the best of us can forget. My dad's on a PPO. We did that on purpose. that's why we did it, because I know he would probably end up needing to see specialists. Um, but I even forgot that he was on a PPO, and I was talking to the doctor, his primary care physician here recently, and I said, "So okay, so when you lined that up," she said, "No, you remember you can choose whatever doctor you want to. We recommend this one because he's good and he comes to the area uh, monthly." So you could try to get on that way. He won't have to drive somewhere, because we do like that particular neurologist. And I was like, oh man, I forgot I have to make that call. They said, if you really want us to, we'll do it for you. I said, but don't forget that you actually have the freedom. You could do it. If he needs to go to an eye doctor, call the eye doctor, do this, that, and that. I was like, man. So I'm doing it, so I know I'm not the only one. So
Right.
don't feel bad. So just remember, uh, that's what makes the PPL so valuable. And when he went to the neurologist was in network, but some tests he needed, the hospital that he was closest to would not have been in the HMO network, but because he was in a PPO, he could go over there and do his testing, and it was charged like just a regular specialist visit. And that was very convenient. I mean, that was seriously convenient, because had he been on an HMO, to go out of network would have been very expensive, or he would have had to have driven about 40 minutes.
Oh,
Yeah.
that's
And
that's
so, yeah, 80 year old plus, not wanting to get on the highway, will, if they have to, drive on the highway. I mean, he doesn't have a problem, but he was like, I really don't want to. I will if I have to,
the
no big deal.
inconvenience
But
of
the
a longer
inconvenience,
commute.
yeah, he just didn't like the length. He was like, I don't want to, because basically what he's saying, I have to get up early. That's what it was. I was like, yeah, it was the retiree in him that was doing the talking. Like, man, I have to get up that early. I was like, okay, moved to the other hospital right around the corner, not even 10 minutes away. And he was like, oh yeah, we can do that one. We can make that work. So, and I even forgot myself,
Yeah, so
you know.
it's just a reminder. Just think about what your needs are,
Hmm.
and if you have hospitals, doctors, even specialists that you're using already, if you like them, just double check to see if they're in your plan,
Hmm.
and if they're not within your network, within your plan, as you're looking at other options, you may want to check to see if they're accepted, because that can easily be checked.
Yes, that can easily be checked, exactly.
Hmm.
So that's number one. Number two is your embedded drug plan, a prescription drug plan. In an Advantage plan, they're usually embedded. They come with the plan, and
Hmm.
so you want to make sure that your prescription, the cost of your prescription drugs are reasonable.
Yes, so those Medicare Advantage plans that have the Part D embedded within them, um, don't assume
Hmm.
that just because it's included and you like how everything works with your doctors and
Hmm.
hospitals and those specialists, you have to make sure that the prescription drugs that you currently take, that they are on their list. They're still
The
accepted.
formulary, you'll see the word formulary, and that's what that
Yes.
means.
So
Yep.
the formulary, and then
Hmm.
there may be levels, or what.
Tiers,
So there'll
tiers.
be
Hmm.
a tier one, a tier two, tier three, or it could say that it's um,
Generic or
a brand
brand.
name.
Yep.
So all of those things do make a difference.
Hmm.
And if you need help looking those up, you can look them up online. You can call and get help. Um, all of that is not something that you should be frustrated to not even look into. We encourage you that you could look it up and research it. You can call and get some help,
Hmm.
whether they be family members or if you're working with a broker or agent. If you don't have anyone, you can call us. We're
Hmm.
happy to help you look it
If
up
we're
too.
broker of record, if we're agent of record on there, we would be able to assist.
Hmm.
Um, but even if not, we would be able to at least walk you through where to find the information.
Absolutely.
Yep.
Absolutely. So double checking to see if it's embedded,
Hmm.
make sure you double check your prescription drugs that you take.
Yep. Yep. Make sure you know what your copays are, and every other thing, because uh, some people, those prescription drug lists can get long. And
Mm-hmm.
the good thing about it, it won't be the donut hole catastrophic, all of this, the risk corridor, all of this good stuff. It will basically be maximum out of pocket, I think, what capped at
Yes,
$2,000.
it's kept it too.
But some people, with the right list, you hit 2,000 kind of quickly, or if you don't have a lot, just make sure you're not overpaying for it.
Yeah, that's a good point too, because some of
Hmm.
the medications, um, they may be considered a brand,
Hmm.
and the cost of that brand may, may eat up that limit.
Hmm. That's right.
So you just want to double check to make sure, and checking around. So if it's embedded in your plan, you check those. The other thing to also think about too is if the cost of your prescriptions is that high, you may want to consider looking to see if you can find another Advantage plan, Medicare Advantage plan, that has everything that you need, the
Hmm.
doctors, the specialists, whether it's a certain HMO or PPO,
That's right.
and then look at a standalone plan that is more favorable for your medications. But only look at that option if it's necessary. We're just saying to make sure you don't have to stay with a plan that has an embedded Part D if it's going to make you drug cost poor.
Right, because exactly. You made an excellent point there. Because sometimes some things may not be important to you on a particular plan. If prescription drug is very important to you, and um, there may be three or four plans available in your area, so now you're able you can compare
Yes.
and then say, okay, well, prescription drugs is very important to me, so we need to look. Let's look at that. So enter all your prescription drugs in there, and then be able to see where you would save the most.
Mm-hmm.
What your out of pockets would be, and then go back into the plan. First of all, make sure your doctors and everything are in network, and then look, and then you have a decision to make.
Yes,
Then
and
you,
also I'm glad you mentioned the doctors and everyone and specialists and hospitals and network. Also check on the pharmacy,
right, that's right.
because you want to
Hmm.
make sure that not only is your prescription drugs, from a cost standpoint, you want to double check to see what are the pharmacies, because sometimes within your area, the closest pharmacy could be, let's say, a Walmart,
Hmm.
instead of 30 to 40 miles away, let's say a CVS or Walgreens.
Right, and also to piggyback off of that, if you're in a smaller towns, rural areas, they still have the local drugstores,
Yes.
with the diner and everything. Don't don't rule them out, because I've seen them really. They really know their community.
Yeah, they know their customers.
Right, they know their customer, and sometimes they may have an abundant supply of particular prescriptions, and so you may have one primary pharmacy. That doesn't mean you can't use others. If
Yes.
they're in net, it's like the other parts. If they're in network, you may get this from Walmart, but you may go get this from your local pharmacy.
Yes, you're.
That local drugstore. Don't
Mhm.
forget that I've seen that work out very well in rural areas, and you know we've actually called the pharmacy, and they said, oh yes, we know that there this percentage of our population is uses that particular, so we always keep it in stock, in supply, a good supply of it. And that's good because the supply is constantly turning, so you're like getting, I mean, it's like any other thing, is pretty like you getting fresh meds for lack of a better term. So, I mean, it's not like stuff expires next week or anything, but that it's just to say that, the pharmacies, they know the local pharmacies, they know their population. And
Exactly.
some of these people, they've been seeing them for a long time.
Right, right.
So
So,
they'll say, we don't normally get that. We don't normally carry a lot, but we can. It's
yes,
not that we don't. We just don't carry a lot of. But population, like where we live, the older population started to really boom, and so the local pharmacy, they responded.
yes, yes,
Yeah, we have the CVS's and the Walgreens on the corners and everything, but the local pharmacies still doing very well.
yes, absolutely. Now, there's one that a lot of people is afraid of too, John, and that is the mail order. Don't
Yep.
Don't
Don't rule it out.
automatically, reject having something mail ordered to you, because it's often convenient,
Oh
because
yeah.
they can send you several months supply depending on the drug. Some medications they will only send you a 30-day supply. The good news is they generally will send it like every 3 weeks, so that way it arrives before your supply's out.
That's right. Um, I remember getting mom on that before she passed, and her prescription drug plan, and she was like, we have to go over here to the drugstore, and I said, why are you doing that? I said, this particular plan, they'll mail that to you. They'll send you a 90-day supply. And she was like, seriously? I was like, yeah. So we set her up on mail, and she was like, well, good. I don't have to worry about it. Now there were a couple she did have to go to the
Yes.
drugstore, like you were saying. They would not put those in the mail, but it went down. It reduced her going to the pharmacy, 70%.
Hmm. Yeah, so
So
it can be convenient,
yeah,
and but don't get upset thinking that everything can't be mail ordered.
right.
There's certain medications and things that
People in big cities, they love it.
well, yeah, I
Yeah,
love it
yeah,
because it's one less trip, and then I'm set every 3 months.
yeah, yeah,
So
exactly. So, and I mean, we're not on Medicare. We're on the under 65 plans, and we get stuff in the mail.
yes.
You know,
Hmm.
um, so that's just something to think about. So we talked about the providers. Make sure your embedded drug plan carries everything. The next one is just the financials of your yearly care, your out of pocket expenses. Your co-pays, your co-insurances.
Yes.
You have to take those in consideration, because, like, for instance, if you're seeing quite a few specialists, most of the time that's more than the primary care visit.
Yes. So let's say you're going to see your primary care doctor. That doctor may be a $25 or $50 copay. Going to a specialist,
Hmm.
whether it's a neurosurgeon or
Or just dermatologist,
yes,
things like that. The basic specialists, the eye doctors, they're
yes,
considered specialists.
they can be anywhere between 65, sometimes $80 a
Mhm.
visit.
Right. And then you also have to look into, some people, they choose particular plans because they have dental plans and things. So you may need to check those costs, because some people, dental is very important. That's why they like a certain plan. Okay. That goes into your co-pays and co-insurances.
And so there's the copay and co-insurance. So the copay is what you pay when you go to the doctor's
Hmm.
office. The co-insurance, that is where you're sharing the cost
Hmm.
of what that doctor's visit is. So um, there's the copay, and that could be before deductible and it could be after deductible. So you want to double check to see if you have to meet your deductible before you can go to that particular doctor or specialist.
Right. So just take that into consideration. Then the other one, the maximum out of pocket. Um,
Sometimes it's called
MOOP.
moot.
Yeah.
You
MOOP.
moop.
MOOP. Maximum out of pocket.
Yes.
Um,
And that's looking at all of your total cost.
Yep, for the year. And the way that works is you have these co-pays, co-insurances, things like that. And say, for instance, most they're between 3 to 7,000 a year. You pay
Yeah.
maximum out of pocket. And once say, for instance, your maximum out of pocket is 3,000. Once you hit the 3,000, you're not paying anything else out of pocket. Me personally, if I see a plan, everything's equal. One has a maximum out of pocket of 3,000. One has 7,000. Which one do you choose?
I'm choosing the
I'm
3,000.
choosing the 3,000.
You
So
probably hit it much quicker.
yeah, well, it's just the fact of it stops at 3,000.
Yes, I know.
Yeah.
I know there is there's a lower financial responsibility for
Hmm.
me by choosing
So
that.
you can actually, okay, I know I need to budget it. The 3,000. That's the maximum I'm going to pay for the year out of pocket.
Hmm.
And sometimes, some people, they may have the budget to go much higher because it may be something else in the plan
Yes.
that's important to them. But to that's important. That's important to me, and will always be important. I mean, if I can save $4,000 a year in something, I'm going to do it.
Well,
All
one
things being equal.
absolutely. So Another thing to also remember is the maximum out of pocket that is per type of plan. So
Right.
you may be looking at your Medicare Advantage plan, and that has a maximum out of pocket amount, but you may also have costs associated with your drug plan.
Right. Yeah, those are totally separate. You're
Yeah,
exactly right.
those
That's
costs.
separate because I mentioned that with the drug plan, that's 2,000. That will be capped at $2,000.
Yes,
So for now, you can budget the year for the year. If it's three with your plan, the
medical.
medical, hospital, and then two with your prescription drugs. Okay, I need to budget 5,000 for the year for that. Or if it's seven, then it's 9,000. So we're looking at 5 to 9,000. I'm glad that you brought that up to really clarify that because that is a huge question. It never fails
Yes.
because people they get older and wiser. Now they're like I'm not penny pinching. I'm just being wise with my
Let's make
money.
sure the
Right?
math is
I don't
mathing.
want to. Right? I don't want to pay more than I have to, and
Absolutely.
there's nothing wrong with that.
Right. And for those who do come into situations where, let's say, the cost is more than what you can manage, there are plans that you can be set up on to help you manage that prescription drug cost. And so it'll set up to where it's a more scheduled payment option for you to pay towards those expenses.
Hmm.
So that's something to keep in mind as well. And if you sign up for one, you do have the ability to come off of it as well.
Yeah. Yeah. So that was number three, the financial component of it. Number four, which unless you're really talking to someone that will explain it, you need to check star rating.
So think about Yelp reviews for
Hmm.
restaurants
That's
and
right.
business.
That's right.
The star reviews is how they rate the insurance companies
Right.
and the plans.
CMS rate them. Right. They do an annual review, and
Hmm.
based on complaints, did they do what they were supposed to do, or is the market happy with it, or did they not do so well? Maybe the doctors complained about the company that's providing the particular services, and so they give them a star rating,
Yes.
up to five. It's up to
Hmm.
5 stars. Uh, three or less is not so good.
Yes.
Three or less is you kind of want to shy away from those.
It's like a C.
Yeah, exactly. That's exactly what it is.
It's a
You
C.
want to stick with the 3.5 and up.
Hmm.
3.5 and up. Um, and ask, don't be afraid to ask, what is the star rating on that? And if you look, if you have your Medicare and you book, or you receive the package, if you're already in the plan and you look at the package, it has it there. It has to.
Yes.
CMS requires it. If you're online, if you can go online, Medicare.gov, go in. If you registered, your information where you can log in, you have an account with them. You've created your account. You go in, look at the plans, and it'll tell you the how the star rating. And so you kind of um, I remember in the beginning, I would hear people say, "Oh yes, when I first started with this one, they were a 4, and something happened. They dropped to 2.5, and I was like, I'm out." I was like,
Yeah.
"Oh well, yeah, that's prudent of you,
Hmm.
very prudent." You don't know what's no, I they won't tell you why it has that particular rating,
Hmm.
um, but I really don't need to know if it's 2.5. I know I'm just not going to deal with it.
Yeah. If the recommendation is 3 and above,
Hmm.
then I'd lean more towards a 3.5
Yeah, I,
and
I stick,
higher.
yeah, and higher, because some they basically repeatedly year after year they stay in the 4 to 5,
Hmm.
year after year, and so those are those were the four main points, the four main items you should look for when choosing a particular plan. This AEP, during
Yes.
this AEP period. Now, what we did, I received a question. Someone, we've been talking about the annual notice of change.
Yes.
And so the question came across, what if I haven't received my annual notice of change?
Well, there's still time. So if you haven't received it, look on the back of your provider's card, and there's the phone number there. You can call.
Yep.
If you have an online account, you can log into your account, but you basically want to call them and let them know I did not receive my ANOC or my annual notice of change, and I would like it to be emailed. I'd like it to be mailed to me. There's different ways that they can give it to you.
Mhm.
You can also ask them, where can I find it online? And then
Yes.
they'll let you know in your account where to go look
It
at
is.
it.
It's there. It's
Hmm.
not. They're not hiding it from you. You know, if you want, the first thing you should do when you enroll, whatever plan you choose, especially if you're new, go to your carrier site and create your account, because everything is there. Because sometimes you may have a question that you just log in and go into your account. The answer is probably there.
Yes,
And
they'll
it's,
have like a
yeah, they
FAQ,
have the
so
FAQ.
different facts with common questions and answers.
Mhm.
Because you're probably not the first person
Oh
to
no,
want to know
no.
some specific information.
No, they
So
don't. They don't do FAQs for just because one or two people. You know,
no,
especially those large carriers. They have millions. It's what 35 to 38 million enrolled in Medicare Advantage plans.
I know it's 35 plus.
Right, and there's only a handful of carriers taking care of all of these people. So any question that you have, they've heard it a million times, literally.
Yes, yes.
They've heard it literally over a million times, and so that's why they have it on the FAQ.
And CMS also
Mm-hmm.
gets a lot of questions or
Mm-hmm.
requires them to provide certain information readily and easily to their members.
Right, and just keep that in mind, Medicare beneficiaries. You're in a special class, a
Hmm.
very special class now, probably one of the most protected classes
Yes.
out there, and you are. I mean, CMS is like, they're like crazy protective over Medicare beneficiaries. Not
Hmm.
any and everything can really happen to them. If something bad happens to a beneficiary, there's it's like a rogue agent that's doing it, or something, or maybe the company is just not scrupulous, and they will get them.
Yes.
I
So
mean,
CMS, yes, it is a government agency.
mm-hmm,
Not all government agencies are bad. This is one that is on your side, making sure that they have the benefits and they're providing the information and the protection and guidelines to get you the support and services that you need for your health care.
that's right. So keep that in mind. You are in a protected class, a well protected class when
Hmm.
it comes to healthcare. I know there's a lot of complaints about the healthcare system, um, and if I could do something about it, I would. But you should know that you are protected. You can't be taken advantage of easily. It may
Hmm.
happen maybe once, but it won't happen again in certain things. And so that's what we wanted to cover. This is the last Friday because you're actually going to AEP. It starts
Tuesday.
Tuesday, so get ready for the phone calls. Um, just be
Emails,
just
text,
email,
more
text, or
things by
whatever. Yep,
mail,
more things by mail. You
more
definitely, yep,
commercials.
yep. Take the bin out to the mailbox because stuff is going to be coming at you. So just get ready for
Just
it.
make sure you
Yeah,
pull out anything
yeah.
from your current
Yeah,
provider
if
so you
it's
don't throw away your
yeah, don't
info.
throw it all away. Look at it.
Hmm.
Just pay attention to it before you just automatically chunk it, because it's really not junk mail yet.
No, no.
Make sure. So that leads us into the question of the day. Before we go, we talked about what you should look for in a plan specifically for you. So just ask yourself this question: what's most important in a plan for you?
Hmm.
What's most important for a plan for you? So, Andre, if you didn't have anything else, we'll sign off here, and we may do another show. Maybe Monday. May do another. If we receive questions, we may do another live Monday, specifically for Medicare.
Is that an invitation to come back?
Yeah, it could be an invitation. You might be doing it by yourself. I don't know. We'll see.
No, we welcome the questions. And John,
Hmm.
thanks so much. I'm glad we're able to continue to keep people informed and
Hmm.
just make sure they're prepared.
Yep.
And if you need any help, don't hesitate to, you know,
Reach
reach out
out.
by.
See our information scrolling at the bottom of the screen, or you can visit johnmcintyre.com and
Mhm.
contact us. If you have any questions, you need someone to talk to, we will definitely do our best to answer those questions, or we'll know where to get the answer for you.
Absolutely. Thanks, John, for having me.
All right. So we'll see you Monday, same time, same channel. Have a good evening.